At some point in your life, you may have to have a tooth removed. If you're having tooth pain now, you may be concerned that a tooth extraction is somewhere in your future. Tooth extraction is a very common dental procedure, with thousands being performed each and every day. A tooth extraction is a procedure that completely removes your tooth from its socket in your jawbone. There are a number of reasons why you may need a tooth extraction. Your dentist may be able to repair some cases of damaged or broken tooth with procedures such as crowning, root canal, and fillings. Cases where the damage is beyond repair, a tooth extraction is imperative. There are also other reasons why you may need to get a tooth extraction. If your teeth are erupting improperly, you may need an extraction to make room in the mouth to get these teeth aligned. People who get braces to straighten severely crooked teeth may need an extraction to make room for teeth that will be shifted into the correct place by their braces. Some medical treatments, such as cancer treatment or people who will be receiving organ transplants, may also require extractions of teeth that are damaged. Finally, a very common tooth extraction procedure is the removal of wisdom teeth, which commonly becomes impacted. There are two common procedures for removing teeth. With a simple extraction, the tooth is able to be pulled out using dental forceps. Generally, a local anesthetic is used to numb the area, and the dentist will use the forceps to loosen and pull the tooth. In other cases, a surgical extraction may be required. For a surgical extraction, the tooth needs to be surgically cut out of the mouth by way of an incision. The tooth may need to be cut into pieces to be removed. For most surgical extractions, you will not only be given local anesthesia, but may be sedated as well. In a simple extraction, the dentist grasps the tooth firmly with specialized pliers, called extraction forceps, and moves it back and forth in its socket to loosen it. The bone of the jaw is compressible to some degree. By forcing the tooth against the sides of its socket, the bone in that area becomes compressed. As a result, the socket becomes slightly enlarged and the tooth loosens. If the tooth is difficult to loosen, an instrument called an elevator or a luxator is used. The elevator is placed between the tooth and the jawbone in order to break the connective tissues known as periodontal ligaments that keep the tooth attached to the jawbone and expand the tooth socket. After the tooth is loosened, it can be pulled out of the bone with the forceps. After the tooth is extracted, the dentist will clean carefully the area to remove any pus or debris and will push the loose gum tissue into the empty tooth socket to encourage healing. You can gently bite down on a cotton gauze pad placed over the wound to help stop the bleeding. The removed tooth can be replaced with an implant, a denture, or a bridge.